Dr. Ann Peters, a renowned American diabetes specialist, once said, "Fruits are not the enemy of diabetics. It's about knowing which ones work with your body, not against it." And she's absolutely right. In this video, we'll walk you through 7 of the best fruits that are not only safe for diabetics, but incredibly beneficial, especially for seniors. We'll also share some tips on how to eat them wisely and what common fruit mistakes to avoid. So, if you or someone you love is over 60 and living with diabetes, grab a pen and take notes, because your next grocery trip is about to get a healthy upgrade. Make sure to watch until the very end, because many seniors unknowingly make one simple fruit-related mistake that silently worsens their blood sugar. Let's help you avoid that today. Fruit. Number 1. Apples. Nature's blood sugar manager. There's a reason the old saying goes, "An apple a day keeps the doctor away." For seniors with diabetes, apples are a nutritional powerhouse that help balance blood sugar and support heart health, 2 of the biggest concerns in aging populations. Apples have a moderate glycemic index, which means they don't cause a rapid spike in blood sugar. One of the main reasons is their high content of soluble fiber, particularly a type called pectin. Pectin slows down the digestion of sugars and helps prevent sudden glucose surges after meals. But apples go beyond just blood sugar. They also support cardiovascular health, which is critical for seniors with diabetes. The antioxidants in apples, like quercetin and flavonoids, help reduce inflammation, lower blood pressure, and protect blood vessels from damage. Another benefit? They're portable, affordable, and easy to eat. A perfect on-the-go snack for seniors who need quick energy without compromising their sugar levels. Just make sure to eat them with the skin on, as that's where much of the fiber and nutrients are concentrated. Be mindful, however, of how you consume apples. Avoid apple juices and apple sauces that are sweetened or processed. These versions strip away the fiber and concentrate the sugars, turning a healthy fruit into a blood sugar hazard. For the best impact, pair an apple with a small handful of nuts or a slice of cheese. This simple combo gives you protein, healthy fat, and fiber, all of which slow digestion and balance blood sugar. Fruit number 2. Berries. The antioxidant kings. When it comes to managing blood sugar naturally, few fruits are as powerful as berries, especially blueberries, strawberries, and raspberries. These vibrant, bite-sized fruits are a diabetic-friendly superfood, loaded with antioxidants, fiber, and essential nutrients. One of the key reasons berries are ideal for seniors with diabetes is their low glycemic index, GI. Unlike high-sugar fruits like bananas or mangoes, berries release glucose slowly into the bloodstream. This helps prevent sudden blood sugar spikes and supports steadier insulin levels throughout the day. What makes berries even more impressive is their high fiber content, especially soluble fiber. This form of fiber slows down digestion, improves gut health, and enhances feelings of fullness. For seniors trying to manage both blood sugar and weight, that's a huge advantage. But that's not all. Berries are rich in anthocyanin, the natural plant compounds responsible for their deep color. These have been shown in multiple studies to improve insulin sensitivity and reduce inflammation, both of which are major factors in long-term diabetes management. How can seniors enjoy berries? Add a handful to your morning oatmeal, mix them into plain Greek yogurt, or toss them into a spinach salad. Avoid store-bought berry juices or jams. Those are often loaded with added sugars. Berries are more than just a sweet treat. They're a natural blood sugar stabilizer and a smart choice for any senior living with diabetes. Fruit number 3. Avocados. The fatty fruit that lowers glucose spikes. Yes, you read that right. Avocados are technically a fruit, and for seniors managing diabetes, they might just be one of the most underrated weapons in your nutrition arsenal. Unlike most fruits, avocados are very low in carbohydrates and sugar, making them ideal for stabilizing blood sugar levels. In fact, a whole avocado contains less than 1 gram of sugar, but packs a serious punch of healthy monounsaturated fats and fiber. These healthy fats do more than just keep you full, they slow down the absorption of glucose into the bloodstream. This results in fewer insulin spikes, more consistent energy levels, and better appetite control, all key factors for diabetic seniors. Avocados are also rich in magnesium and potassium, two minerals that support heart health, reduce blood pressure, and improve insulin function. These benefits make them especially helpful for older adults at risk for complications from diabetes, like heart disease or kidney problems. What's more, avocados contain lutein, a nutrient that supports eye health, another major concern for diabetics, who are more prone to vision problems like retinopathy and macular degeneration. Seniors can enjoy avocados in a variety of delicious ways: mashed on whole grain toast, sliced into salads, blended into smoothies, or turned into a simple guacamole. Just be mindful of portion sizes. A little goes a long way, thanks to the high calorie content. So while it may not taste sweet like other fruits, the avocado offers sweet benefits when it comes to blood sugar, heart protection, and overall senior wellness. Fruit number 4. Kiwi. Small but powerful for blood sugar and digestion. Don't let its small size fool you. Kiwi is a diabetic-friendly fruit packed with nutrition that offers big benefits for seniors. Known for its tart sweet flavor and vibrant green flesh, kiwi is a low glycemic fruit that doesn't cause rapid spikes in blood sugar levels. That makes it an excellent addition to a senior's diet, especially for those managing type 2 diabetes. One medium kiwi has only about 10 grams of carbohydrates, but it's loaded with vitamin C, potassium, and fiber, nutrients that are essential for immune health, heart function, and stable digestion. Kiwi is also incredibly hydrating, making it ideal for seniors who may struggle with staying adequately hydrated throughout the day. But perhaps one of kiwi's most underrated benefits is its digestive support. Kiwi contains a natural enzyme called actinidin, which helps the body break down proteins more efficiently. For seniors with slower digestion or acid reflux, this can be a real advantage. A smoother digestive process means less stress on the body and more consistent nutrient absorption, both crucial for blood sugar balance. Several studies have shown that regularly eating kiwi may help reduce HbA1c levels, your long-term blood sugar indicator, especially when consumed as part of a balanced diet. The best way to eat kiwi: simply cut it in half and scoop it with a spoon, or slice it into a salad. And here's a tip: you can actually eat the skin too. It's full of fiber and adds a mild crunch, though some people prefer it peeled for a softer texture. So, next time you're shopping for healthy fruits, don't skip over the humble kiwi. It may be small, but it's a mighty ally in the fight against unstable blood sugar. Fruit number 5. Grapefruit. The citrus wonder for stable sugar and fat burning. Tart, juicy, and refreshingly light, grapefruit is one of the most powerful citrus fruits for managing blood sugar and supporting weight control in seniors. With its very low glycemic index and high water content, grapefruit is an excellent fruit choice for diabetics. What makes grapefruit especially impressive is a compound called naringenin. This bioflavonoid has been shown to improve insulin sensitivity and help regulate glucose metabolism. In simpler terms, it helps your body use insulin more effectively, reducing insulin resistance, a common challenge among older adults with type 2 diabetes. Grapefruit is also very low in calories and sugar, but high in vitamin C, potassium, and antioxidants. These nutrients support immune health, reduce inflammation, and protect the heart, a critical benefit for seniors with diabetes who are more vulnerable to cardiovascular disease. There's also some exciting research suggesting that eating half a grapefruit before meals may help promote fat burning and lower blood sugar levels after eating. That makes grapefruit a helpful addition to weight management efforts, which play a major role in long-term diabetes control. But here's an important caution: grapefruit can interact with several common medications, including statins, blood pressure meds, and even some diabetes drugs. The fruit affects how the liver processes these medications, potentially increasing their strength or side effects. So, before adding grapefruit to your daily routine, always consult your doctor or pharmacist. The best time to eat grapefruit? Try it in the morning on an empty stomach or about 30 minutes before your main meal. Avoid sugary grapefruit juices or canned versions in syrup, Stick to fresh slices or segments. When eaten safely, grapefruit is a tangy powerhouse that can help seniors with diabetes maintain better blood sugar and feel more energized throughout the day.
Subscribe to my YouTube channel, please.
Fruit number 6. Cherries. The anti-inflammatory sweet treat. If you're craving something sweet but want to keep your blood sugar in check, cherries might be your new best friend. These small, juicy fruits are not only delicious, but also surprisingly diabetic-friendly, especially for seniors who also struggle with joint pain, inflammation, or poor sleep. Cherries have a low to moderate glycemic index, which means they're digested slowly and have minimal impact on blood glucose. 1 cup of fresh cherries has about 22 grams of carbs, but they're also packed with fiber and antioxidants, especially anthocyanins, the plant compounds that give cherries their deep red color. Anthocyanins are powerful anti-inflammatory agents. For seniors, this is a big deal. Chronic inflammation can worsen insulin resistance and contribute to complications like arthritis and heart disease. Eating cherries regularly may reduce C-reactive protein, CRP, a marker of inflammation, and support better metabolic health overall. Cherries also contain melatonin, a natural hormone that regulates sleep. Poor sleep is often overlooked in diabetes management, but it's directly linked to poor blood sugar control. So if you're struggling to fall asleep or stay asleep, a small bowl of cherries in the evening might help your sleep and your sugar. However, not all cherry products are created equal. Avoid canned cherries in syrup or sweetened cherry pies. These are loaded with added sugars that can send your glucose levels soaring. Opt for fresh, frozen or unsweetened dried cherries if fresh ones aren't available. You can add them to oatmeal, salads, yogurt, or enjoy a small bowl as an after-dinner treat. Just remember, moderation is key, even with healthy fruits. For seniors with diabetes, cherries offer a sweet, satisfying, and inflammation-fighting snack you can feel good about. Fruit number 7. Pears. The fiber-rich, low-GI fruit for seniors. Rounding out our list is one of the most underrated fruits in the produce aisle, the pear. Soft, juicy, and refreshingly sweet. Pears are a perfect option for seniors with diabetes thanks to their low glycemic index and high fiber content. 1 medium pear contains about 6 grams of fiber, much of which is soluble fiber. Soluble fiber slows the absorption of sugar into the bloodstream, preventing spikes in glucose after meals and improving overall insulin sensitivity. This makes pears not only a gentle choice for blood sugar, but also a great aid in digestive regularity, something many seniors struggle with. Pears also contain flavonoids, plant-based compounds shown to lower the risk of type 2 diabetes by reducing inflammation and improving insulin function. In fact, some long-term studies suggest that people who eat pears regularly have a significantly lower risk of developing diabetes in the first place. Unlike fruits that may cause sugar levels to rise rapidly, pears offer a steady release of energy. This can help prevent the post-meal crashes that leave many seniors feeling tired or weak. To get the most benefits, eat pears with the skin on. That's where much of the fiber and antioxidant content resides. Soft, ripe pears can be sliced over oatmeal, added to salads, or eaten fresh as a refreshing snack. Roasted pears with a touch of cinnamon also make a wonderful dessert without the guilt. Just be mindful of overly ripe or canned pears packed in syrup. Those can be too sugary. Choose firm, fresh, or lightly poached pears for the best blood sugar results. In short, pears are a gentle, nourishing fruit that support your digestive system, heart, and blood sugar. All with a satisfying sweet flavor seniors love. Bonus tips for seniors managing diabetes. Now that you know which fruits are best for managing diabetes, here are a few important tips to help you get the maximum benefit without risking blood sugar spikes. Pair fruits with protein or healthy fats. Eating fruit alone, especially on an empty stomach, can lead to quicker glucose absorption. Instead, pair your fruit with a source of protein or fat. For example, apples with peanut butter, berries with Greek yogurt, or avocado with boiled eggs. This combination slows digestion and keeps your sugar levels more stable. Stick to whole fruits over juices. Fruit juices, even 100% natural ones, remove the fiber and concentrate the sugar. This can cause a sharp blood sugar spike. Always choose whole fruits over juice or smoothies. Be mindful of portion sizes. Even the best fruits can affect blood sugar if consumed in large quantities. Use the fist rule. Your serving of fruit should be no bigger than your clenched fist. Stay hydrated and walk after meals. Drinking plenty of water helps your kidneys flush out excess sugar, and just a 10 to 15-minute walk after eating can significantly reduce post-meal blood sugar level. Remember, you don't have to fear fruit. You just have to make smart choices. By choosing fruits with a low glycemic index, rich in fiber and antioxidants, and pairing them wisely, you can enjoy the sweetness of life without sacrificing your health. As Dr. Ann Peters said, it's not about cutting out fruit, it's about understanding which ones support your body's needs. So go ahead and enjoy your next apple, your handful of berries, or that slice of avocado toast. Just do it with confidence and control. If you found this video helpful, please give it a thumbs up, share it with someone you care about, and don't forget to subscribe to our channel for more senior health tips every week. Tell us in the comments which one of these fruits will you be adding to your plate this week.